Now we're going to look at two of the more controversial aspects of the healthcare reform bill, the individual mandate and the employer mandate. This is an idea that was proposed by Republicans and conservatives in the early 1990s. Rather than require employers to cover all their workers, there should be individual responsibility, people said, and individuals should have to have health coverage, and we should have a mandate on individuals. Well, the Democrats embraced this idea, and it was part of the Affordable Care Act. It begins in 2014 and is phased in. Basically, the individual mandate requires that all U.S. citizens and legal residents have health coverage that covers the 10 essential health benefits. By 2016, people without medical coverage are going to have to pay a penalty for not having that coverage. That penalty begins in 2014 and is phased in to take full effect in 2016. That penalty is $695 per year per individual beginning in 2016, or up to 2.5% of a household income, whichever is larger. The individual mandate has exemptions for certain groups. For example, if you object to health insurance, you're a Christian Scientist, you don't have to pay the mandate. Undocumented immigrants who are not allowed on the expanded Medicaid or the exchanges don't have to pay if they don't have health coverage. Incarcerated individuals in prisons and jails aren't affected. Next, there is also an employer mandate. Employers with more than 50 workers have to provide coverage for their full-time employees, where full-time employees is anyone working over 30 hours per week. If they don't provide them health insurance, they pay a penalty of $2,000 per worker after the first 30 workers. It turns out that this employer mandate actually doesn't penalize that many employers. Why? Well, 96% of companies aren't affected by the employer mandate to begin with. They actually have 50 or fewer workers. So most companies in the country, the employer mandate doesn't apply to. And the big companies, those with more than 50 employees, actually the vast majority of them already provide health insurance to their workers. 94% of companies with 50 or more employees already offer insurance. It turns out that most experts calculate that the employer mandate is really going to apply only to about 12,000 businesses with 1.5 million workers. It is not that big a problem. The Affordable Care Act also recognizes that many employers were offering insurance, but individuals were not taking up health insurance. And so it tries to incentivize people, understanding that it's a lot easier to get people to sign up for something when they're automatically enrolled and have to opt out. So employers with more than 200 employees under the Affordable Care Act have to automatically enroll their employees in health insurance, and then employees who don't want it, either because a spouse already has coverage or they decide it's unaffordable, have to actively opt out of that system. That is assuredly going to increase the number of people who have employer-sponsored insurance. So now we've seen the second major part of the Affordable Care Act in its expansion of coverage, the individual mandate that requires Americans or legal residents to have health insurance or face a penalty beginning in 2014, and the employer mandate that requires companies with more than 50 employees to offer health insurance to their full-time employees or face a penalty of $2,000 per employee. Next, we're going to turn to health insurance exchanges, probably the most novel and innovative part of the Affordable Care Act's expansion of coverage.